everybody, how you doing? This is a momentous occasion. Goodness me.
Yes.
The news, we just got the news. Biden is our 46th president of the United States, and even better for my Caribbean American people, the lovely Kamala Harris is our vice president. And she's Jamaican. Look here. She's also Indian American, so we have to acknowledge that side of her as well. But she is a child of immigrants. And for all of you who are, whether you immigrated here when you were a child or it was your parents that brought you here, you must feel some sense of pride as an immigrant, no matter the country you come from. Democracy has been served, just like how my Los Angeles Lakers served for. Gotta show my LeBron games. My team served in the NBA, so I'm having minus the fact that COVID almost killed me, but I'm having a fantastic 2020 right now. My prayers have been answered. Shout out to all the African ancestors that jump up and decided that this was going to happen. This is Mind Health Matters, and every couple of weeks I'll be speaking here with our very special guest, Dr. Flavia DeSouza. Sorry. DeSouza. She is a clinical psychiatrist. Got it right?
That's correct.
And she is Yale trained. So she will be talking about mental health issues. Go ahead, if you're watching this right now, you can go ahead and put your messages in the chat to ask Dr. Flavia questions. So our main topic today is going to be the heavy emotions we've been feeling over the last few days. Some people have been angry. Some people have been sad. Some people have been depressed. Some people have been feeling these really intense emotions and anxiety as well. So last time we spoke about anxiety. Let's talk now about why do we feel heavy emotions? Like what happens to our body physically when we have these heavy emotions, and what can we do to contain that?
So for those who missed our last episode, just kind of going back to the example that we used when we talked about an anxiety response.
Yes.
Some scientists, when they talk about emotions, it's not just what is happening in the mind, but also what is happening in the body. It's your body is emoting something. So you might get on a stage and feel anxious about presenting, but sometimes that actually feeling in the mind doesn't come, it's just a body reaction. So your palms might get sweaty, your heart might start to beat. And then when you have this physical reaction in your body, you register it in your mind. And you say, you give a name to it in your mind. Oh, I'm feeling anxious, or oh, this is happening to me.
Yeah.
And so that is one way to think about it. And so I'd encourage people to, if they want a refresher, to just go back, because we really broke down what it means to experience and think about anxiety last week. And this can be really extrapolated to all emotions that we're experiencing. So there's what is going on in the body. And then in the mind, there are associations, and there are parts of the mind that are responsible for or deeper feelings. So those areas of the brain might light up when we see something and we have an association with it. And so we might think something or experience something in the mind. And so for some people, they might hear something on the news and they might experience their stomach getting into a knot.
Guilty all of the last 3 days.
Right. You might feel nauseous. Some people had diarrhea. That's a response, you know. It's not because you eat the wrong food. Sometimes your body is responding, and that is, sometimes we don't have the words to say, okay, we're having diarrhea now, what is going on? I'm feeling is the anxiety. So when we have these certain things happening in our environment that are causing a reaction in our body, it is because certain hormones are being released. So the very basic way to understand it is that there are hormones like adrenaline or cortisol that are released when we are in certain circumstances, and those hormones affect the whole body. So the example to use that.
So feeling ill and feelings of, you know, we get the bubble guts you know, when I thought Trump was winning, that is a normal physical response to an emotional stimulus, correct?
Exactly. That is exactly right. And you know, feelings in and of themselves are not a bad thing. They're indicating to us that something is going on our inside, and sometimes we have to pay attention to what is going on.
Yes.
We're in a society now where things become incredibly fast-paced, and so we've learned not to pay attention to our bodies. We've learned not to pay attention to our emotions. We've learned not to pay attention to our feelings. And so sometimes it's actually hard for us to identify this is what is going on, and this is why I'm experiencing this.
I see.
So the example I wanted to give to make it more kind of physical or medicine, because a lot of people may be able to relate to this, is the thyroid. You know, the thyroid releases a hormone called the thyroid hormone. So a lot of people, if they've experienced physical issues, they understand. And that hormone affects many different parts of the body, many different organ systems in the body. And when that hormone is high, you should have a subjective sense of anxiety. You can end up going to
Dr. DeSouza, you've frozen. You're frozen. I'm not sure why, but in the interim, I really encourage everybody to go ahead and watch the piece that we did last week on anxiety. If you're someone that's suffering from anxiety, this is a very, 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 very important video for you to watch. I think you should go and check it out. It's right here on our YouTube channel on Island Fever Live. And it's definitely something that we talked about a lot of things. We talked about how anxiety can actually physically affect people's ability to work. And for us Caribbean people, you know, it's kind of like, okay, so you're tired, so you're depressed, get over it, right? But that's not the way to look at these things. It's really, the way to really look at this thing is for you to see and realize that these people are in fact suffering. And if these are members of your family, then you should probably reach out to someone that can help, right? So for example, I know a couple of people who will just be productive, and then just disappear. Just totally disappear. You don't know why, you don't know when, there's no communication, you don't know if they're all right, and then reappear. And it causes quite a bit of worry for you if you love and care for the persons. But at the same time, there's a tad bit of an annoyance because you're going, you can't live like this, you know? But at the same time, what you have to understand is these people need your understanding. They're suffering from a mental illness. It's not their fault. And you have to do your best to exercise as much patience as you can. You've got to be a lot more patient with these people, and just really kind of help them to move forward or move towards a place where they feel like they can be all right. A lot of times too, what they need is medication. There's probably something wrong with them. And I hate to use this because this is a negative connotation. There's probably something wrong with the way their neurons are firing in their brain, and they need medication to help balance their mental state. And that doesn't mean they're crazy or they're cuckoo and, oh my God, I don't want to talk to her because she's crazy, or I don't want to talk to him because he's crazy. What it really means is they, just like you'll take a pill for a headache, just like you'll take a pill for a migraine, just like you'll go to the doctor and you go get your knee fixed. Sometimes you have to go and you have to get your mind fixed. And that is what is really important and I've found in dealing with and working with people who have mental issues, that has been my way of dealing with them is from a place of understanding. And once you come from a place of it's not their fault, like if I broke my knee, it's not my fault, right? If I broke my toe, it's not really my fault. Or maybe it's my fault. Maybe I jump off a building and crack my toe, right? But even still, you would give me more understanding than you would if I told you I was having anxiety and I just couldn't show up today. And so we have to start looking at this as a mental health issue, and then we can move from there. I believe we have Dr. DeSouza back with us. Hi, Doc. I told the people all about our chat with about how to deal with mental health.
I apologize for that.
No problem. I'm
not sure what's going on today.
Yeah, there's a lot of internet issues. Even where I'm at, a few roads away from me, they haven't had internet for about 4 days. So there's something going on. We're not sure the grid. Something's going on with the grid.
Yeah, and I'm sure a lot of people are getting on the airwaves right now, following what's happening, reading the news and things like that. So what did I miss?
So I talked about how we should treat people with mental illness with a lot of empathy, and we should treat it like we would if they broke their toe or broke their knee. They just broke their mind, and there are ways to fix it, and just encourage them to go and get the help that they need instead of needlessly suffering, and you know, hating themselves to the point where sometimes they might commit suicide. You know, you have to more understanding as a society of people who are experiencing these kinds of debilitating mental illnesses like anxiety that affects their day-to-day interactions with people. Yeah, that's it. That's all it is. So you are talking about strong emotions, right? So my question is,
yes,
somebody says something and get me well raw. Right? I'm a Kingston girl, okay? I'm a fighter. I'm a brawler, yeah? A lot of people don't know that about me. So, fun fact, guys, I'll knock you out. But only if I'm like seriously, like, see, it takes a lot, but my temper is a little notorious amongst my family members. So, for me, anger management is something I had to learn because as a child, I was a bit of a fighter. I was the 6-year-old fighting with all the boys. And so, you know, I'm fighting for my sisters, and I would defend my little sister to the ground. But you know my little sister, Crystal, I used to fight for her in primary school. And all the boys were scared of me. So, and I was like, this is skinny. I don't know why they were scared of me, but they were. And my sister is not like me. My sister is, you know, my sister, she's like that with her mouth, but she's not a brawler like. So there's a lot of anger management I had to learn, and patience is a big one. And for me, it has been the ability to not allow someone else's thoughts or words or action to affect me internally.
So that's a really important point, and so there are different ways to think about it, and I think you've said a lot of very complex things actually. So the first thing is, when something happens, how do you take a moment to recognize this is what I'm feeling? So that's what we were getting to before.
Yeah.
And then when you recognize what it is you're feeling, what do you do with that? So in many therapies actually, so this is a lot of social workers do this, a lot of psychologists do this, some psychiatrists do this in their office. The goal of some therapies are to help people create space between the thought, the feeling, and the behavior. And there are specific therapies that are, I don't know if you follow what I'm saying. So sometimes people have a feeling, And then maybe there's a thought associated with it, and then there's a behavior. And for many people, the feeling just is like the behavior comes immediately after the feeling. So somebody step on your toe, you can't believe them step on. Well, you may not even think about that, but you immediately move into the response where you are going to fight the person. And so
let's do one that's a little more practical, because most people won't fight the person who's
no. Yeah.
But let's say, for argument's sake, you already have a relationship with a coworker that's passive, right? That you know they don't like you and they know you don't like them, and there's this underlying issue going on between both of you. And one day that coworker passes and deliberately bounces you on the shoulder. No, you know, we Jamaicans, we don't do that, right? That's a fight. But you're at work. And so, like you said, you have to create space if you want the job. How you feel when you want to thump her down.
And what is the consequences of thumping her down?
Consequences of thumping her down. So that's kind of the analogy that I would put into how to deal with emotions. For the people just joining us, we are talking with Dr. Flavia. You can go ahead and post your comments in the chat. Ask questions. We're talking about how to deal with intense emotions on Mind Health Matters this week. So now that I've decided I'm not going to thump down this girl, right?
Right. You have to decide. So it's okay to have the feeling of anger.
Right.
It is okay to even think in your mind that, you know, I may want to aggress this person. So you've created space now between the feeling.
You put it so pretty. I want to, what was it?
Aggress.
No, I want to thump.
And so you've now created the space. The next thing is that you have to go into yourself and say, what is the kind of person that I want to be?
Yes.
So do I want to be true to my sense of humanity? And what does that mean for me? So that takes, even before situations like this happen, people have to do some kind of reflection and inner work to determine the kind of person that they want to be while they're living here on this earth.
Absolutely.
Right? So that's, and that process gets faster and faster for people who practice it on a regular basis. It gets faster and faster. And then what are you going to do with your feelings? So there might be different ways to deal with those feelings. It's not necessarily that you're going to just suppress them, but maybe there are mechanisms in the workplace, since you use that example, to try to deal with this person who is attacking you, or this person who is doing something to harm you in the workplace. Does that all make sense?
Yeah, it does make sense. So if I'm there and she is somebody is upsetting me or something like that, then I know in that situation I have to exercise that level of control. But let me ask you this, doctor. Family members have a way of being able to dredge up, I mean, in ways that your coworker cannot incite certain feelings. Family members, spouses, siblings, best friends, that sort of thing. They have a way of being more effective in allowing a person to lose control. Why is that?
We have a deeper relationship, and the trigger goes much deeper. It cuts more.
I see.
You know, so, and there are many different reasons and layers for this, which is why if you're having consistent problems in important relationships, it does not hurt to get some counseling from somebody who is expert, because then they're able to separate out what is happening in the moment from other deeper issues which may exist that may actually be, leading you in a certain direction, leading you to respond in a certain direction. So that is why I would say that. I mean, for a certain, and then the other thing too is that, especially if there is difficulty in the relationship, the person might know you in a way that your coworker doesn't. So they might know what your personal insecurities are. You may have been vulnerable with that person and really shared openly. And so sometimes when there is even conflict, it may feel like a betrayal. It will hurt a little bit. It will hurt a little bit or a lot more than with somebody that you don't have a relationship with.
Yes.
Yes. And so that can be particularly painful. And sometimes when we are in pain, we react in ways that we may not otherwise react in situations like professional situations or with colleagues or with acquaintances.
I got you.
Mm-hmm,
So it's a matter of making sure that we kind of find a way to find that calm in these situations. So what do you think is best to do?
I do want to say, though, that, it's easy for me to say find the calm in the situation. Some of us may need more help than others. And if the relationship is deep and complicated, we may need external help. We may need an eye outside of what is going on to be able to say, oh, what is happening right now is not just about what is happening right now. It is what's happened 5 years ago and 10 years ago and all of these things that were not properly dealt with.
I see.
And sometimes what happens in early childhood, the trauma that people experience in early childhood or even adolescence, even if they experience it in the family, those were formative years and important relationships. So some of those individuals may go out into their workplace and may react in ways that are more aggressive than someone else might react because of how they were primed in early childhood or the ways that they needed to defend themselves in order to remain safe, or just putting it very basically that maybe they were taught that relationships were not safe and they had to do certain things. So I want to make sure that we recognize that there's a spectrum of individuals who, some of us can really get it together and say, okay, we're able to separate the feeling from the emotion. Other people really have a more difficult time with that, and there are many reasons for that. Yeah.
And that can so do you think like flogging children, heavy flogging, not the normal thing that we are used to in the Caribbean, but like abuse of any kind is has something to do with persons who have a lot of anger?
I would say so, and I know this is a particularly controversial topic, especially in places where administering discipline is a part of administering discipline would be corporal punishment, some kind of corporal punishment. However, in many instances, the person, especially if they're not able to control their anger or the flogging is heavy, or like as you said, you use the word abuse, it's abusive, that really can affect a person for a large part of their life. So there are many lessons that they're learning. If I speak up, this is going to happen to me, I'm going to be abused. Or maybe when the person who abuses me is the person who also loves me, so I should expect this in relationships. I should expect that this is maybe even how they show that they're loving and affectionate to me. So a lot of people can't understand, well, why that woman stay in that relationship? This man is doing something, but maybe it was modeled early in her life. Maybe her interpretation is that this is the way that he loves me, when it is completely dysfunctional.
I see. Okay, so back to feeling intense emotions, right? How do we deal with grief? Like a lot of Trump supporters right now are feeling a little bit of grief. And I do not, though I'm happy for Biden and Harris, I don't want anybody to feel grief. I felt that grief on Wednesday night, and it wasn't pleasant, How do you catch yourself with disappointment and grief? How do you manage an emotion that is that intense?
I would say two things come very quickly to my mind. The first is grief is a normal response to loss or anticipated loss. And there are stages of grief, which don't just include sadness, but also include anger and sometimes rage.
Rage is a part of
sometimes people experience that. Yes, it's that process. So it's not just when people say grief, they just assume it's sadness, but it's not just that. It's why did this happen? Who can I blame? Should I blame myself? Sometimes that anger is turned inward and it becomes more than sadness. Maybe it becomes depression. So there's recognizing that I'm experiencing this because I have experienced this loss, and that's okay. The issue is when it becomes more pathological, when it is causing dysfunction for a long period of time, or when the person is not able to recover from it, or when it is leading into significant anxiety that cannot be dealt with by using your friendship network or changing how you think about the situation. The next thing that comes to mind is kind of a reassessment of the situation,
right?
And looking at the big picture. So, and this is something that is an important part of the therapy that I mentioned before. There are certain psychotherapies that we use with our patients, and even anybody that might be wanting some advice or seeking some guidance. An important part of cognitive behavioral therapy is learning to think about the same situation in different ways. So over the past week, when I was watching the news, people were responding, and people said many different things. Some people said, the country has been divided for a long time. That's not what this is about. Some people said, we just have to let the process work. The important thing is not necessarily who wins or who loses, but that democracy is allowed to happen, that all of the votes are counted. And so there are different ways to look at the same situation. Perhaps there's an opportunity in this loss or this change. So instead of thinking of it as a huge failure or a disappointment, how can we move forward together? Maybe there is something that these two new leaders can offer me and my community. How might I be able to work with those who have been appointed in power, especially if they are reasonable? That is important, as opposed to just being divisive at this point. The other thing too, and I know people have different perspectives and people have different allegiances, but one of the things that I really appreciated that Biden said is that even though he was running as a Democratic candidate, if he were to win, which he has won now, he is going to be an American president, not a Democratic president.
Yes.
So it's just a slightly different way. You're turning the light on the issue in a different way, and that may be useful for people who are experiencing loss or grief.
Okay. And that's, there's so many of us need that right now. So how about when a person is when you're on the receiving end of a person's rage, how does one manage that?
That's a really good question. And, I think this is a crowdsourcing question, because I'd love to hear how people have been managing it. I can respond from my perspective and from the perspective of the people who are in my lives and the patients I've worked with and some of the books I have read. But it'd be really interesting to hear. I'm sure people have different ways that they have been managing that. I would say, and this is not, just to make this clear, this is not clinical advice that I'm giving, because I'm nobody's doctor on air, even though I'm talking from a place of a certain amount of knowledge and experience. Like, you're not under my care. Yes. And so my advice is limited. But the first thing I would say is, if you are experiencing somebody's anger or rage that's been directed at you, there are a couple different things that you must consider. The first thing is, how sturdy am I and how boundaried am I? How much of that am I letting into myself? And if I'm letting a lot of it into myself, why might that be? Right? So the rage might be directed. You said, so you said in the beginning something that was very important, and you alluded to it, and I'm going to say it in a different way. Sometimes when we have a reaction to a person doing something to us, we are giving them power.
Yep.
We're letting go of the power that we have and the autonomy that we have, and we're giving it over to them. Yeah. So a very common thing might be, so-and-so made me do this. It might feel like that, but that is not true. Nobody picked up your hand to thump your coworker.
Yes.
Right?
Yes.
And so if something is going inside of you and penetrating you that way, the question is, why is it penetrating me so much? Why am I allowing this to affect me so much? Why is this called?
What if you don't like the answer then, Doc? What if you realize, oh wow, I just punched my coworker. Why did I do that? And of course the answer is, I'm an angry person. Where do you go from there? Because there are two places to go. It's either stupid, 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 I hate myself, or I gotta fix this? And if so, what are your tips? How do I fix that? Right?
I'm not a proponent of people further self-blaming and further hurting themselves by negative self-talk. I don't think that goes anywhere. You know, I don't think, I think that causes more hurt and grief and harm than anything else. The next thing I was going to say is that, to your point, how do I fix this? How do I address this after you do the internal work? If you don't have people in your corner that you can talk to, sensible, wise counselors, friends, you might have to seek, if you see it as a problem, like an ongoing issue, because remember last week we talked about the distinction between a feeling, everyday regular feeling, and a disorder, something that is causing dysfunction in your life, in your work life, in your social relationships, in your financial life, then you might have to seek out some assistance, and there's nothing wrong with that. Maybe you didn't get that assistance before, and so you don't really know how to move forward. And other people may have gotten that assistance in their everyday lives.
Yes.
You know, they may have gotten that assistance in the home that they were growing up in terms of the guidance that they received or the friendships that they had. Maybe you had to be struggling or focus on other things, moving forward, your finances or your professional life, or figuring out things for your children. And so you've not had the space and time to get that kind of help.
Yeah.
And there are many ways to seek out help in this day and age. It's not necessarily just speaking to a professional. There are many, many websites. There are many offerings online on YouTube.
Yes.
Many people who are making themselves and their minds available to your service. And so it doesn't have to even be that, okay, I'm going to be spending money or I'm going to be divulging this information to somebody if you're nervous about that.
Okay. So all right. So I can find somebody to talk to about managing my emotions and managing my, my heavy reactions to things. But I feel like every person has a moment where they have a visceral reaction to something. And it's not necessarily because they have a disorder. And I feel like those people might need a tool or two, or a tip or two from you, Doc, on how to kind of grab the genie back and put it back into the bottle.
Grab it. All right. So after it has happened, if you've done something and you say, well, boy, I wish I didn't do something like that.
Or you're about to.
Or you're about to.
How do you
control emotion? I think it is just that. It is just that recognition. It is just that simple. And for some people it's not simple. And that is what I have seen in my work with patients. It is simply, this is how I am feeling. How do I want to move in this world? Slow it down. What are the consequences of this action? Am I okay with it? And for many people, they've gotten to a stage where they can do that very, very quickly. For some people, it's not until after the fact.
I'm very good at doing that.
Yeah. Some people it's not. Yeah. Some people it's not until after the fact. It's not until after they get into an altercation, or maybe they curse somebody out, or maybe taking it away from the aggression. Maybe it is that they have they get so anxious that they can't speak. The person has done something, bounced them in the workplace, and they are so upset, but they're so anxious that they can't speak and they don't know what to say, and they wish that they could speak a little bit more quickly or clearly in that situation. It is just that reflection, and then knowing, and this is something critical, knowing that if this is a issue that repeats itself over and over, it's going to happen again. Trust that it will happen again, so you will have an opportunity to practice. And maybe before it happens, you might say to yourself, if I'm in this situation, what might I want to say?
Yeah.
Maybe have a line in your head. Okay, I prefer for you not to bounce me at work. Or please don't do that again. And you say it out loud, outside of the situation.
Outside of the
situation. You might say it out loud. Because the thing is that after something like that has happened, especially if you've noticed patterns, it will happen again.
And you'll be prepared the next time.
You'll be more prepared. You'll be more prepared the next time.
To be more express your feelings and what you're feeling and so on.
Yeah. I will tell you this, as a person who provides and has provided psychotherapy, one of the things that had made me anxious initially was if a patient is coming into the room and saying something, I felt as though I needed to address it. And if I didn't address it, I would lose the opportunity. But I learned consistently with people over time, if something is important or if something is relevant to a person, it will come up again, maybe in a different form. And so my main job is to do reflection afterwards to say, okay, this came up. How might I think about bringing it back into the treatment space again when it does come up, when the person indicates that they want to talk about it? And it's the same thing with behaviors and other people. Sorry, go ahead, Candice.
No, go ahead. And this is very insightful. I actually wanted to also steer it in a place where we're blamed. Because I feel like a lot of us don't take responsibility for things. We look for people to blame. But I feel like that should be a whole nother show. In and of itself, the ability to take responsibility. And I think we're all guilty of that. Everybody likes to find someone to blame. And I'm sure the current president and the president-elect, but more so the current president, will do a lot of that this week. A lot of us will do a lot of that this week in our normal lives, over simple things, right? And sometimes larger things. And let's say, for example, divorce, right? Somebody is going to blame someone. Both people are going to blame each other. But how many of them are looking at themselves? How many of those relationships that break up, friendships that break up, right? How many of us really look at our contribution to the demise of that relationship? I feel like we should talk about that next time. Because that's a whole nother story of things. But I just, you bring up the blame thing with managing emotions. And I realized just in sitting here that blame is a symptom of, and I'm not trained, but for me, it's a symptom of somewhere in our minds, a little bit of guilt. And I'm not sure, I don't know, I'm just saying, you can tell me otherwise, but blame again is associated with emotion. So that chain link that you spoke about, could you just repeat that again, where you said we have to put some space between?
We have to put some space between the emotion. So I want to define how I use the word emotion. Very specifically, I'm going to say our physical response to something that is happening, right? Or feelings, which is the interpretation in our mind, or thought, which is, I can go back to your same example, and then the behavior, which would be in your example, thumping this lady, or freezing up and not speaking.
Right. The record people, I never thump a co-worker before.
No, of course. we're using an extreme example to illustrate an important point. And this we're really illustrating an important point, which is that a space needs to be created, because so often it's emotion behavior, and actually a lot of things are happening in between, and it takes practice to slow that process down.
Yes.
And then it even takes more practice, if you're not used to it, to change how you would normally behave in a situation. Right? That's the more difficult thing. Yeah. How you behave, and then some of that you have to rewind and say, well, how do I change how I behave? My interpretation of the situation might have to be different.
Yeah. Wow. Well, Dr. Flavia, this was very, very insightful. So if we are to take away anything to me from this conversation, it is, in managing our emotions, create space between, slow it down, and create space between the feeling, the thought, and the action. Beautifully said. Thank you so much.
You're welcome. You're welcome. And I always have a plug. The plug is, if you can't manage, you can always get some assistance. Nothing is wrong with that.
If you can't manage, always know you can get some assistance. Nothing is wrong with that. Dr. Flavia, where do we find you? We want to ask you some questions. Put your brain chat to you. Where do we find you?
Okay, let me pull it up on Instagram because I'm getting used to this.
This technology. People have to be helping.
Should I put it in the comment? I don't have an ability to put it
in the comments.
I don't think I can do that.
Yes, man, you can in the comment section. You should be able.
I don't know where. I don't see the part for me to type in.
It's on the far right at the top, I think.
I clicked on comments, but I'm seeing your comments, but I'm not seeing where I can type it in.
There's not a little box here. Yeah. Okay, I will.
That's all right.
I'll type it in. Can you private message me?
Yeah. I can private message you.
And then I'll just copy it and paste it into the.
Yeah, definitely. It's at Dr. Flavia DeSouza on Twitter.
Okay. At Dr. Flavia.
DrFlaviadesouza on Twitter.
Got it.
And then on Instagram is Mind Health Matter. No S, just MATTER.
No S?
No S. Mind Health Matter on Instagram.
Mind Health Matter on Instagram. All right, guys. Well, this has been another Mind Health Matter right here as we spoke about another matter, which was managing our emotions during this very tumultuous time. Managing our anxiety, managing the anger that we may feel, managing misunderstanding.
Yes.
And
grief.
And grief. We tackle grief as well.
Yeah.
And managing how we look at situations as to not blame others. So our next show, we're going to dive a little bit deeper into blame and the correlation between blame and a lack of taking responsibility, which I'm sure we will see play out in the this news cycle this week, but also plays out in our lives, and we are all guilty at some point in time.
Definitely. It's hard for us to look at ourselves.
Yes. So we're going to talk about looking at ourselves in our next episode of Mind Health Matter with the lovely, lovely Dr. Flavia DeSouza.
Thank you so much, Candice. Thank you.
All right, guys. Remember, you can check us out on Instagram, Facebook, Island Fever FM. And we will make sure you check our story on Instagram. We'll have questions. We'll allow you to throw in a question that you want Dr. DeSouza to answer. And we will be here for you Saturday mornings. All right. Have a good week, Doc.
Thank you. Same to you.
Bye, guys.